Joining me now with more on the significance of today's congressional hearing and on the continuing controversy over President Obama's health care reform laws, Chris Niedermeier. She's creator of the political blog StraightScoopPolitics.com, and Chris is joining us from Connecticut. Got far enough away from the Capitol as you could, I imagine. What's your takeaway from today's hearing? What's the key takeaway, would you say?
Well, I think Secretary Sebelius was smart to apologize and take responsibility for the glitches in the computer system. And clearly, the Republican members of the committee who have been fighting against Obamacare, the Affordable Care Act, for years now, will use any possible computer glitch or privacy issue, a plethora of issues they raised today to try to defeat the program. But I think it's important to keep the eye on the ball, and that is that we have 48 million Americans that are uninsured, and you can't throw the baby out with the bathwater. The administration needs time to get this system, get the computer system up to snuff. They should have had it up to snuff, particularly knowing that the Republicans were fighting this in Congress to defeat it. But the important thing is that over time, the proof is really in the pudding. If in time they get the computer problems worked out by the end of the month, if in time enough people sign up between now and March, you will see, I think, a program that in time people will accept, just as they did back in 2005 when the federal government rolled out the Medicare prescription coverage program, and there were 1 million glitches when that was first rolled out. This is a massive program, the Affordable Care Act. There are 13,000 new health care products, and the federal government should have gotten it right in terms of these computer problems. But the good news is it's fixable, and if they do fix that, then the real issue is, are the benefits of the program over time something that the American people are going to want? And I think that is the case.
Chris, let me ask you, because you used to work up on the Hill. I've spoken to people who've testified under the bright lights in these sorts of hearings. They describe it as actually going into a boxing ring, that the lawmakers really aren't looking for answers, but they're just trying to score points in front of the cameras. Is that pretty accurate?
Well, that certainly seemed to be today, and it has been. When you vote 44 times to try to defeat or defund Obamacare, and then you bring people up before the hearing to score points, that is a lot of what was going on today.
Okay, the Europeans have a lot of this sort of medicine. They don't seem to have any problems, and they undoubtedly are watching this broadcast and saying, how come the United States is pretty good at spying on us, the allies, and they're having such a tough time getting this system up in place? What would you say?
Well, certainly the security problems and the computer problems are things that they could have fixed. And you're right. You do raise a good point. If we can spend our time spying on people all over the world and we can't get the system up, we should have. But, the primary responsibility for getting the system up really wasn't with Secretary Sebelius and her department. It really was the Medicaid and Medicare centers. And that official who heads up that center testified yesterday on the House side and took responsibility as well. I think what's important to remember is a lot of the Republicans on the committee today were raising the issue of people having their insurance canceled, and that's a legitimate point because President Obama did promise that people could keep their own insurance. But if you look at the projections under the program, about 38% of people are going to be eligible for Medicaid insurance through that. Another 51% are going to be able to be subsidized because of their income levels. But it's that 10% of Americans who are making enough money that they're going to have to pay more in order to get a plan that meets the requirements of the new law. That's where the heat is going to come and the rubber's going to hit the road. And that's why a number of members of the House and the Senate, in my view, are saying, let's get this implemented as soon as we can so that by next November, when we're up for re-election, we're not going to have people banging down our doors saying, I'm not going to vote for you because the benefits of the program haven't begun to sink in yet. That's why it's critical that these computer problems get worked out instantly so that young people who are healthier, who need to sign up in order for the program to be financially effective, do so. The concern that I think is a legitimate concern is that this gap of time is going to prevent them from doing so and discourage them from doing so.
We're gonna have to leave it there. Thanks so much, though. Joining us from Connecticut, Chris Niedermeier with her observations on the Obamacare.
Good to be there.